that, I am excited to introduce you to Dr. Mack. She is the Associate Director for the Center for Embodied Equity and Neurodiversity at the University of San Diego and is an advocate for inclusive education who's dedicated her career to creating learning environments where every student feels valued and supported. Her work centers on transforming systems and mindsets to ensure equitable access, belonging, and success for all learners, especially those with disabilities and neurodivergent identities. Through her leadership, research, and professional learning, Dr. Mack empowers educators to challenge barriers and design schools that celebrate diversity as strength. So, Dr. Mack, thank you for being with us, and we're going to hand it over to you.
Thank you so much. I'm so excited to be here with you all. I've just been reading all of the chats to see where you all are coming from. So I'm so excited that we're able to gather here today. So, all right, let's get started. Okay. You can see? It's good. Okay, thank you. All right. So our agenda today, we're going to discuss the neurodiverse nervous system. We're going to talk briefly about the 8 senses. We're going to go through a sensory profile for you to understand your own soothers and stressors, as well as how you can apply this with your students. And then we'll talk about neuro-inclusive environmental design. So really quickly, I just wanted to start talking about disciplinary action. So this whole series is about behavior. So for our students with disabilities, oftentimes that results in disciplinary action. And we know that students with disabilities are overrepresented in disciplinary action. So you can see some of the stats here. Receiving in-school suspension, out-of-school suspension, 21% receiving expulsion, 27% being referred to law enforcement, and then 28% receiving a school-related arrest. And then, of course, we know that race and gender compound this issue. So you can see here, the difference between Asian girls who don't have disability compared to Black boys who have disability and the disparity there. So then I just want to pause, right, with those statistics. How would you respond or adapt if you knew that at least some of the behavior incidents that we're seeing are related to stressful nervous system sensory responses and not willful defiance? So they're not doing it on purpose. They're not trying to just be defiant, right? So what if some of those things are related to the nervous system and how our environments are stressing these students' nervous systems? So when I say neurodiverse, I just want to make sure we're all on the same page. So we're talking about a natural variation, so not a deficit, not a pathology, so just a natural variation that we can expect in brain function and behavior that expresses with both challenges and natural advantages, so both. So the term started in the autism movement, but it has since expanded to include ADHD, sensory processing disorder, highly sensitive persons, PTSD, traumatic brain injury, and dyslexia or other learning disabilities. And we also know that it very often occurs with a mental health diagnosis. And it's estimated that approximately 15 to 20% of the global population is neurodiverse in some way. Okay. All right. So when we talk about the nervous system, we need to talk about the vagus nerve. So vagal tone is measuring the level of activity of the vagus nerve, which is a major nerve that connects from your brain to most of your major organs in your body. So if you have high vagal tone or you have a very active vagus nerve, that means you're more able to recover from stress. You have improved emotional regulation and attention, which then of course leads to lower stress, anxiety, and improved mood. On the other hand, if you have low vagal tone or your vagus nerve is less active, then that is typically associated with poor emotional or attention regulation, higher stress reactivity, and the reduced ability to cope with stress. When we're talking about neurodiverse individuals, we know that people with autism and ADHD tend to have lower vagal tone, which we measure by measuring heart rate variability, which leads to a less flexible and more rigid nervous system. So as a function of their diagnosis, they have they may have, not always, less flexible and more rigid nervous system. So that's why we see that they like things a certain way, and things that might be, not very stressful to you can be very, very stressful to them. And then because of when they're stressed, the higher levels of cortisol and adrenaline running through their nervous systems, it can take them longer to recover. So the good news, I definitely want to be clear here that this is not like set in stone. There are ways to improve vagal tone, right? So it's not like this is forever. And the work that we do helps both educators and students to improve their vagal tone, right? So that they can become more flexible and have a less rigid nervous system. Okay. And then because we, again, know that neurodiverse diagnoses often occur with mental health diagnoses, we also know that students who have experienced adverse childhood experiences, they also have reduced vagal tone. And then those who have been exposed to trauma, they also, we see in the research emerging that it's affecting their sensory processing and their sensory function as well. So that's why when we talk about behavior and the environment, it's really important to consider the nervous system of these individuals. All right. So again, I just want to take a moment to pause and read this quote. "The burden of adaptation should first be placed on the curriculum, not the learner." And I want to be really broad in our understanding of curriculum there. So for us today, it's going to be about the environment, right? Because the environment is teaching us things and giving us things as well. Because most curricula are unable to adapt to individual differences, we have come to realize that our curricula, rather than our students, are disabled. So really, this is when we talk about behavior, it's almost always about ways that we can improve the child's behavior. So today I want us to step back and think about things that we can change within the system, the classroom, the environment that can help students. All right. So the 8 senses, we know typically the 5 senses, right? Visual, hearing, smell, taste, and touch. And then today I'm also going to talk about vestibular, which is your sense of movement and balance, proprioception, which is your awareness of how your body is in space, and then interoception, which is your sense of internal bodily sensations, such as hunger, needing to go to the bathroom, those types of sensations. Okay, so when we talk about these senses, there's hyperarousal or hypo. So hyper is heightened, right? So you're much more sensitive. You're receiving way more information than everybody else, versus hypo, right? Which is reduced sensitivity. So for each of the 8 senses, we're going to talk about what that looks like, hypo versus hyper. So you can see on the left-hand side, hyposensitivity. So students who are hyposensitive to visual stimulation, they enjoy looking at reflective, bright, spinning objects or lights. They might struggle to distinguish objects within busy backgrounds, and they might have trouble naming colors, shapes, and sizes. On the other end of the spectrum, you have hypersensitivity. So because they are hypersensitive, they might want to avoid stimulating surroundings. They might struggle with tasks that require processing visual information. They're bothered by intense light, and then they might even start to have physical symptoms such as headaches or nausea after prolonged exposure. So you can see I have the heart here in the middle. So this is where we want to be. This is where we feel really good. We're feeling calm, but not so calm, like on the hyposensitive side, that we're just laying on the couch, completely vegged out, not paying attention, watching Netflix. On the other end of complete opposite hypersensitivity, we're revved up, we're ready to go, right? So we want to be here in the heart. So those students that you have that might be hyposensitive, they're looking for more stimulation to bring them up to this heart in the middle. On hypersensitivity, we might need to bring them down a little bit to the heart so that they can not be so overly stimulated. Okay, all right. In the chat, can we see what are some behaviors? So today we really want to talk about reframing behavior, right, through a nervous system lens. So what are some behaviors that you might see from a student who is hyposensitive? Some behaviors that you may in the past have misunderstood or misinterpreted as defiance, or they're just being distracted. Staying out of the chair, I see. So they're looking for more things to be stimulated by, right? Walking around, running around the room, roaming. Yes, looking outside. Yes, these are all really great. So again, these are behaviors that we might otherwise class as they're, not paying attention. They are being defiant, right? But they're looking for things to stimulate them so they can get up to that middle section, the heart, right? Okay, what about some examples of hypersensitivity? What are some behaviors that we might see for students who are overly stimulated by our classroom environments? Heads down, crying, oh, yes. Covering ears, yes. Screaming, hoods on, yes. Okay, these are all really, really great examples. Again, so these, if we reframe these behaviors as there's something in the environment that might be causing these behaviors, right? We can reframe what it is we think we should do to fix that, right? Okay, so for each of these, then we can go through and you can list what are your sensory stressors or sensory soothers. And I just want to stress, these are just examples I've put here. Everybody is different, right? Everybody will find different things to be stressful. Everybody will find different things to be soothing. And you might find somewhere it's just a preference for you. You're right. You're already kind of right there in the middle at the heart. There's nothing really that it might just be a preference for you, but you don't really care one way or another. Okay. Somebody want to share in the chat some examples of something that might be soothing to you, that you know is soothing to you, and something that you know that is stressful to you? Ooh, spa music. Okay. Lights off. Blue light is soothing. That's interesting. So some people find blue light not to be soothing, right? They would find that to be very stressing on their system. Yeah. I love these examples. I see massage. Again, for some people, the massage might feel good. They like that pressure. They like that touch. And for other people, it's the complete opposite. They can't handle that, right? Okay, very good. So the goal then, again, is for you as the instructor, or whatever your role is, to look at your environment and how you've designed your classroom or your space to be soothing to you, but then to realize that for your students, they might be experiencing it completely differently, right? So when we understand what our sensory soothers and stresses are, and then understand our students, then we can start to make adjustments. Great, thank you so much. Really good examples in the chat. Okay, so hearing, same thing. On the hyposensitive side, you have students who may struggle to pay attention to noises. They have trouble following auditory instructions. They crave really strong auditory experiences, again, because they're looking for something to stimulate them, to bring them up. Decreased reaction because of differences in auditory perception. On the other side, hypersensitive students, they may have strong aversion to different sounds, difficulty focusing due to different sounds, or increased sensitivity to particular noise. So I know last week there was a question that came up about classical music being soothing, and Dr. Nikki reminded us, of course, of the need for that you want to be culturally responsive and making sure is that appropriate for your classroom and the students that you're serving. But I'll also say that people experience music differently too, right? So there's definitely classical music that is not meant to be calming, right? So the pieces that are set, to represent, I don't know, they're about to go into battle or something, right? So like those types, so just because it's classical music doesn't mean that it's soothing, right? Okay, very good. Same thing. So what might be some sensory stressors? What might be some soothers? What are things that stress you out, that make you nervous, make you anxious? And what are things that really calm you and soothe you? For touch, hyposensitivity, enjoying activities that involve deep pressure. Again, they're looking for more stimulation. Unintentional harm to others due to not being aware of pressure, right? They think everybody's feeling the way, so they push really hard. Limited awareness of dirt on their skin or runny nose, and then they might really enjoy fidgeting and touching objects. On the opposite side, hypersensitivity, preference for specific foods, temperatures, sensitivity to temperature changes, intolerance of stickiness or mess, difficulty with grooming or hygiene tasks. Okay, so I think some of our examples that we've talked about in the chat with hearing and seeing, what about this in the classroom? How might we see the sense of touch in the classroom? What are some stressors or soothers in regards to touch? Oh, banging on things. Oh, refusing to engage in sensory play. Yeah, we think all kids like Play-Doh, all kids like playing with the shaving cream. Maybe not, right? Sticky tables, squishy balls, weighted blanket. Yes. Proximity to others. Some students love pressure. Children love touching everyone, right? Okay, very good. All right, so again, these are all things that we can control in our classroom, right? Okay, all right. Again, so you might be different on these. I don't like really rough, abrasive textures. Some people, they like that, right? They like having that sense of touch and feeling those for others. So this might be different to you. Gustatory, so that's taste, detecting flavors. Hyposensitivity, they have appreciation for really robust, strong taste. They feel more awake or alive after experiencing really bold flavors, and they might crave really particular consistencies, like they want things to be crispy. On the opposite end of the spectrum, having increased sensitivity to food, or they might have a really strong preference for a really narrow range of foods and a reluctance to try new items. They just want what they're comfortable with. They might be uncomfortable with foods that have mixed textures. And then they might want to avoid eating food in public situations. So again, you can just profile yourself and know what your stresses are, what your soothers are, what your students are. For smell, hyposensitivity, they again have a appreciation for really robust, strong smells, that should say, sorry. They feel more awake, craving, oh, this is, sorry about this. Okay. So this would be really strong smells, right? Some people, they really enjoy those smells. I am not one of those people. I don't like the perfume department or Bath and Body Works. It's really overpowering and like assaulting to me. Yeah. Okay. All right. Proprioception, which is your body awareness, being aware of your position of your body in space. So these students who have hyposensitivity, they might have a difficulty knowing the appropriate amount of pressure to apply. They might enjoy jumping or bumping and crashing into people. They might really like really rough play with their friends. They're not trying to hurt their friends, but that's what they enjoy. They might really crave pressure and bear hugs. They might dislike physical touch or be uncomfortable with physical play on the other end of the spectrum. Vestibular movement and balance. So students who are hyposensitive, they're continuously seeking vestibular stimulation. So things like swaying, rocking, bouncing, or leaping. Hypersensitive students will feel anxious during movement activities, and they might have trouble coordinating and controlling their body. So things like ADHD, that looks like they have too much energy, right? But really it's a hyposensitivity where they're looking for things to stimulate them, right? They're trying to come up. So actually ADHD is hyposensitivity, hypoarousal. They're looking for things to be more aroused. So, okay. Our last one is interoception. Hyposensitivity would be the limited ability to perceive pain and temperature cues. Having decreased sensitivity to feelings of hunger or thirst. They might have challenges recognizing and understanding emotions. Hypersensitivity, they have greater sensitivity to hunger, pain, and thirst cues. They might experience emotions with heightened intensity and then continue to experience pain signals for a longer period of time. Okay, so it's going backwards. Okay, so let's stop here. Can I see in the chat, what are some of our thoughts so far on the sensory profile, understanding your own sensory needs and how that has caused you to design your classroom or your space in a particular way? and how that might be for your students who are on the opposite end of the spectrum as you in some of these areas. What are some of our thoughts? Liz, how can you best meet the needs of all students in a classroom? Really great question. If everybody's experiencing all of these things differently, how can we create a classroom space that's fitting to everybody? We will talk about that. Really good question. Yeah, it was eye-opening that some of the same exact things that help others might hurt others. Essential oils, yes. Yeah. Okay, so I see a lot of comments, and I might be missing some because they're going really fast. But I see a lot of comments that are focused on the kids, on the students. So again, I want to bring us back to that quote about the curriculum being disabled, not our students, right? How have we designed our classrooms and our spaces to meet what our sensory needs are, right? And what are our needs, things that we need to be calm and regulated, right? Because if we're not calm and regulated, that definitely translates to how we are interacting with our students, right? So I want us to think about that as well. So yes, our students are experiencing all these things that I see in the comments, but also I want us to think about the way that we're designing things to fit our sensory needs, right? Yeah. I function better with organization. Okay, I see a comment, lost sound, can't hear you. Can everybody else hear me?
Yeah, we can hear you, Sylvia.
Okay, thank you. Okay, being aware of our own precipitating factors, yes. Okay, very good. Okay, so with that in mind, then I have two different pictures of classrooms here. So this one's kind of old school. I know we don't really have desks that look like this anymore, but this might be a classroom that would be really soothing to me as an instructor if I am on the hypersensitive side, right? This is really nice for me, right? Very little visual stimulation. Things are nice and neat and orderly. There's no clutter at all, right? But for your students who are hypersensitive, how might they be experiencing this classroom? What are some behaviors we might see in a classroom like this? Sarah says it's boring and dull. Oh, it's an obstacle course. Yes. So sensory seeking, not enough stimulation. Students may be bored. Yes. So what are some behaviors that we'll see out of that? So because they're sensory seeking, because they're bored, there's not enough stimulation. What are some behaviors? Inattentive and restless, running, not off-task behaviors, yes. So again, these are all things that we can reframe, right? Seeing them as off-task behaviors, they're just not paying attention, they're being nosy, right? It's actually could be a sign that they are seeking more stimulation. If we added that stimulation to our classroom, right, we might see those behaviors go down. Yes, the need to touch objects and people. Okay, so then the other end of the spectrum, I would say, this picture of a classroom, there's a lot going on. It is pretty neat and orderly. The chairs are still in a row. I don't see a lot of clutter, but it's really overstimulating. What about this? What are some behaviors we might see? Overwhelming, too much distraction. Oh, headaches, yes. Overwhelming, anxious, distracted. What are some behaviors that we might see from feeling overwhelmed, anxious, or distracted? Pulling things off the wall, yes. Difficulty focusing on task, Shutdown, frustration, putting head down. Yes, pacing and wandering around. Okay, yeah. So the goal is to be able to find something in the middle, right? Both of these pictures that I chose are on kind of the far ends away from each other. So we had a question earlier of how can we create a classroom that fits everybody's needs. One way is to create sensory zones. So you want spaces in your classroom or whatever your space happens to be for varied sensory stimulation. So areas that are both more stimulating and then areas that are less stimulating for your students. And we really want to normalize that students have control over their sensory stimulation, that they can tell you when they're overstimulated and that they know. So if you've gone through this profile with them, they know what they need to calm down or to be more stimulated to bring them up a little bit, right? So that's one way that we can meet everybody's needs, is that you have areas in your classroom for both, where they can go whenever they need. We really want to create more predictable routines, so that reduces the cognitive load for students. Ways to do that is to have clear sight lines, signs, so really clear about where things go, where things are in the classroom, so that, again, it reduces that cognitive overload. Dr. Nikki talked a little bit last week about biophilic design. Does anybody remember what that is? Biophilic, or just you already know? What is biophilic design? Nature, inspired by nature. Yes, excellent. So we know that exposure to nature is really associated with improved cognition, function, brain activity, blood pressure, mental health, all the good things. This is especially true for students who are in urban environments and they don't see a lot of nature, right? They're surrounded by a lot of concrete, a lot of buildings. So it's especially true for those students. So any ways that you can bring in natural elements. For some of you, that's really as easy as, I saw one of the comments, letting your windows be open so that people can see outside. Not all of you have spaces where you have a window or the window doesn't open up to a nice, beautiful nature scene. So you can do things like bringing in plants into your classroom. I've seen teachers who just bring in like big tapestries of some, like a tree or the ocean or something like that, so that they can bring it in that way, working with the space that they have. You can also use nature sounds. I saw somebody wrote that in the comments. Yeah, so like ocean sounds. Some people like the thunder, I think, for depending on your age of your students, and then also just the experiences of students. The thunder might be a little frightening for them, but some people like it. All right, acoustic comfort. You want to try to minimize the noise pollution. So things like the HVAC sounds, right? Like that humming can be really distressing for some students. And then just all the stuff that's going on outside. Creating predictable routines in visual order. So having schedules for students to see what's coming up next, being organized with labels, color coding, things like that. Again, to create that organization, reducing that cognitive load so students don't have to worry about that kind of stuff. And then co-designing with your students, again, giving your students agency and normalizing that they know for themselves, right? You're not going to maybe know and be able to design for all of your students, but if they know themselves and they are able to tell you what they need, then that's really helpful to you. Okay, so I wanted to end with some pictures of some teachers that we work with. So Dr. Nikki mentioned that we work with school districts across the state. These are pictures and quotes from teachers that we've worked with in the Berryessa school district. So this is a teacher who created this calming zone. So again, her classroom wasn't one, she had kind of limited space, but this is an area where students who are overstimulated can climb into and have that visual stimulation reduced and sort of be in a closed, cozy environment. And she has little sensory things in there for them. And then they know, whenever they need it, they just go in there for a few minutes and then they come back out. And they don't abuse it. They're not trying to hide in there and play all day. They know how to use it well. And they just go in whenever they need. This student here, he has autism. So you can see the students are all here. He's at the back. So that he's not causing a distraction to his peers, but he just sits on this chair. It can spin. So he, when he finds that motion of spinning to be calming, right? So again, we could look at this behavior as he's not paying attention. He's just playing, right? But this is actually helping him to get to that state where he can really focus and to pay attention. And then I included some quotes here at the end that hopefully will give you some ideas of ways that you can introduce some of these things to your space. I used to feel helpless when I had students who were restless and not able to sit in their seats. Now I allow my students to go for a 2-minute walk or run a lap outside whenever they need or ask for it. So I think she had a classroom where she was in a good space that she could prop open the door and she could still watch them as they did that. They were safe. As a result, my students are less anxious and feel more liberated to speak up for themselves whenever they need a break. Another teacher says, I didn't think much about how the room made students feel. Now I ask them where they would like to sit. We have cleared up some of the areas so they're less cluttered. They covered a desk with butcher paper. Now there's less mess in the classroom. Students are more productive in getting their work done. Students can scribble on the desktop. So that's what the butcher paper is for, without getting in trouble. So again, we could see a behavior like doodling as they're not paying attention, right? And I remember I used to doodle a lot, and I remember always getting losing points on my assignments because I was doodling, but that was a way for me to focus, right? So adding the butcher paper onto his desk, he's not damaging the desk, he can scribble, he's not getting in trouble, and it might be helping him to pay attention when he needs that added stimulation. This teacher says, previously, I did not focus on nature or its power to ground students. I have now brought students outside to teach. It was uncomfortable at first, but they understand it with practice. The students are more aware and interested in nature surrounding them. I am noticing that they are adapting to the outside and bringing calmness into instruction. This person says, I had a cold, loud classroom. Now I realize it's not just my comfort, but the comfort of the classroom as a community. I have the ability within myself to adjust the needs of my students and space. I realize even more how an environment can make some feel happy, anxious, shy, and that just being a nice place to be doesn't always communicate the love and safety I want in the space. So there's a difference in it being a nice place and it actually communicating safety and love and belonging for students. This person was a social worker, so this is her office that she's talking about. When she saw students for services. I didn't take into consideration my students' opinions on what they would want to have or see in the classroom. Oh, I'm sorry, this is another teacher. So I asked my students' opinion regarding what a perfect classroom should be like. I had the students sit in their chairs or on the carpets on designated spots. Now I let my students sit wherever they want for the most part. They love sitting on the table the best. Most students can focus for longer periods of time and their participation has increased. The students were clustered at the kidney table, but now I'm more relaxed in allowing students to sit where they want. I am the one who moves around the room to provide support instead of having the student come to me when they need support. When I give them the option to sit anywhere in the room, they were happy and willing to do the work quietly. I was surprised that a couple of them moved really far away from everyone. So again, we might think when we let them choose that they're all going to want to sit by their friends. That's true for some students, but for some, maybe sitting that close to people was really overstimulating for them. All right, this is the social worker. I used to choose where I would sit with students when we would meet for services and didn't think about how the room might affect them. Now I tell them to take a minute to get their bearings, and once they feel like they have a good sense of how they feel in the room, they choose where we sit and talk. I can visibly see their bodies and faces relax. The student usually chooses to sit where I have something to touch. It has made a difference in how quickly the students begin to open up. I think this is the last quote. So every time I opened my classroom door, the kids loved to run to the door and check what was going on outside. I thought it was very disruptive. But then this teacher noticed that there were no windows in the classroom. So she purposely gave them more outdoor brain breaks. And she noticed that the kids can concentrate better after the outdoor brain breaks. So again, rather than seeing the behavior as disruptive, she saw it as a need that her students were telling her about. And then she met that need for them. Okay, so those just the references at the end if you're interested in checking any of those out. I'm like 20 minutes early, so lots of time for questions or anything, comments that you might want to ask.
Yeah,
Dr. Mack, that was fabulous. Sorry, Janelle.
Oh, I was just going to say, maybe we can pause for a moment and give folks an opportunity to throw some questions in the chat. Dr. Mack, I know, is willing to help us make this as applicable as possible. So if folks have some particular ideas or things they want to toss around, please take a minute here to throw questions and ideas in the chat.
Yes, thank you. Sorry, I was getting over a cold a little bit last week, so I apologize for
That's okay.
coughing in the tea. Okay.
You can put it in the chat or the Q&A, Sarah. We're all hands on deck, so we'll get your questions.
Okay, I see one. What would be a good essential oil? So it depends on your goal, right? So peppermint, eucalyptus, things like that, those are stimulating for your students who are hypo-aroused, that's what they might need to be able to focus better. So peppermint, I think, has been shown to increase that focus and that stimulation. On the other side, calming ones are things like lavender, right? So it just really depends on what your need is, what you're trying to accomplish.
Dr. Mack, can a student be hypersensitive, adverse to something one day, minute, and that same stimuli be calming the next?
Yeah. So I should have mentioned that, right? So with across the different senses, they can be hypo on one and hyper on the other. And then again, we're learning so much more about how trauma impacts these things, right? So I don't know the exact situation with your students, but definitely one thing that is calming one day might set them off for another reason. It might not be, right? There's a whole bunch of stuff that it could be. Yeah. So again, if you take the student and go through the profile for them, and they know things that are, that are going to work for them when they're feeling a certain way, that could be helpful for that student.
That is really a challenge, though, to serve that student who it's always changing for.
Yes, yes.
I love this next question. How can you best meet the needs of all students in a classroom?
Yeah.
Sorry, go for it.
No.
I was going to say, I would think about environmentally, just the makeup of your classroom. How are you going to support that learner who is think about just in lighting. How do you support both needs for something as important as lighting?
Yeah, so definitely there are things that are kind of like universal. So like natural lighting is we all respond really well to that, right? So that's something that you can do. So covering up the fluorescent lights. So even though for some people so for me, I don't notice the flickering in the fluorescent lights, it doesn't bother me. But for some students, it really does. So covering those lights, that's a thing that's good for everybody, right? Bringing in nature, bringing in the nature sounds, plants, opening the windows, fresh air, that's also good for everybody, right? So I would say choosing things that are good for everybody, and then having those spaces for varied stimulation that students know that they can go to when they need it.
Dr. Mack, someone put here in the chat, which I appreciate, that they're going to work on their beginning of the year getting to know you activities and worksheets to start to learn what the sensory preferences or needs might be of their students. Do you have any resources or tools that you could point us to that would be a way for us to ask these sort of questions to either get to know our students, but also help our students get to know themselves as learners?
Yeah. So we have, so on the PowerPoint, those boxes, we have a document that I can share where you would walk students through that. So it's just the boxes. And for the slides, I had an example in each one, but the document has it blank so that you can go through students. And you can modify it. So for the younger ages, you might want to include a picture or something so that they know. For the older students, who can read, you can leave that on there. But yeah, so just going through them, and that's something for, right? So nobody ever asked me that till I was, way old, right? Like nobody asked me as a kid, right? So it's practicing that with your students, right? And teaching them that language. And it may be things that they've never thought of before, right?
Right.
Yeah.
So we'll work with you to get that resource, and folks, we'll get it uploaded to the Padlet after this session, because it sounds like that is something that might be valuable to our participants.
Yeah. And it has the arrows on there too. So you can use that as a visual for your students too, right? That the heart is where we want to be. Sometimes you're here, sometimes you're here. We want to get to the heart. What are things that help you get to the heart?
That's great. Yeah, I wish I would have learned this about myself when I was little.
Yeah. I mean, when I was teaching too, like my classroom wasn't as sparse as that picture, but I don't like a lot of stuff, right? And I think about my students who are running around looking for stuff, and I didn't understand that why they were doing that, right? And it was give them a sticker chart, sit down for 15 minutes or whatever, you get a sticker, right? which wasn't really solving anything, right? But that was the space that fit my sensory needs, right?
Mhm.
Yeah.
Carrie, you want to take that next
There
question?
are still a bunch of questions, Dr. Mack. Is there an online assessment for vagus nerve sensitivity?
Oh, I don't know. I can look that up. So Dr. Nikki is really the expert on vagal tone. So she teaches for the Polyvagal Institute, which is all about the vagus nerve. So I can ask vagal tone sensitivity.
Yeah,
Okay.
and an assessment for that.
I'll
And
ask.
what might be a way to figure out if a student was hyper or hypo if they are not able to verbalize?
Mm. So were we talking non-speaking students or just they don't know, so they can't say?
I'm going to say both.
Okay. Yeah, so definitely for non-speaking students, I think it's really important to always be presuming competence, right? Just because they are not verbally telling us, right? There are definitely other ways that that they can show us. I think giving a lot of examples, right, is helpful for students. I think noting things as they happen too, right? So if you notice a student is overstimulated, pointing out you might be feeling this is what it feels like to be overstimulated, right? And let's try these different things and see which one helps you, right? So it's just helping them to come to that. Again, this is not language that's normal for a lot of kids. Nobody's ever asked them, so it's very likely that they won't be able to verbalize it. They won't really know what you're talking about, right? So I would say noting things as they happen, giving examples, and just trying things and seeing what works. And as you notice them, oh, I noticed this helped you feel calm. I noticed this helped, this kind of made you really excited, right?
I love that. It is all about the noticing because
Yes.
when you have that inability to communicate what your needs are, it made me really think about that interoception. That was new for me. I may have been in the industry a long time, never heard that before. And I thought about how hard that is for teachers. And
Mhm.
unless you have a really great relationship with their caregiver, you don't know when they're sick. And
Yes.
that's scary and hard to
Yeah.
know.
Mm-hmm. It really is
Is
about noticing. I think teachers were paying attention to so many things all the time, right? And this is,
Yeah.
we weren't taught to pay attention to it. And those of us who are not sensitive, right? It's a privilege we have to not have to notice those things, right?
Right.
Mhm.
oh, and everybody knows if I don't feel good.
Yeah.
So
And everybody
I've
knows if it's too hot in the room for me.
uh-huh.
Another question that came up, in addition to trying to get to know our students, is there an evaluation tool that you can provide that would allow us to take noticing of what does exist, what might be missing from our environment? So
Yeah.
some sort of teacher evaluation tool that we can self-identify what we need
Yes.
to attend to.
Mhm. So I can share those resources. So those teachers that I mentioned, they go through an environmental audit. So we have things that you'll want to look for, things, and again, it's things that you might not have ever noticed or paid attention to. So that worksheet kind of guides you through that.
Great.
And Dr. Mack, that was actually my question
Oh,
because I wrote it in there because it gets overwhelming when you're looking around your room and trying to be very, very thoughtful. I was thinking the whole time I would miss a bunch of stuff because forever I had a CAL FIRE station like 3 blocks over. I never paid
mm,
attention to the siren. I could tune that right out. But my
mhm,
students noticed it and I never thought to look and to really hear what's happening in my classroom. And so I think it's important to have a place and a space to really gather and collect that data to support each other in looking at
mhm,
this, not as a supervision tool, but as a thoughtful tool. Like, how are we
mhm,
creating our classroom to be supportive? I love that you have a tool for that.
mhm. Yeah, the sirens can be distracting just from the noise, but then from a trauma-informed perspective too, right? Hearing a siren go off all the time, that can be really upsetting.
Hmm.
Do you
Yeah.
have some strategies or ideas that you might recommend for bringing students into the creation of their learning environments and helping each other identify what their needs and preferences are so that we can really like attend to that inclusive environment that we're all going to have different needs on different days And so working as a collaborative community to do that together.
Yeah, I love that you included the students in that, right? Collaborative community, right? So as you saw from one of the quotes, the teachers just asked their students, right? They just never had before. They just, this is my classroom, this is how I do it, this is how it is, right? So just asking, what are things you guys like? What are things you want to see in here? What are things that bother you in here, right? And then I think in terms of colleagues, right? Going into each other's classrooms and spaces, and how does it make you feel? What are things you notice in your nervous system when you go enter that space, right? Which is a refuge and very calming to that person. But for you, how does it feel for you when you and sharing those thoughts with your colleagues?
Yeah. And for our middle and high school educators, I'm thinking about having, designated spaces across the classroom. So each class period can have their own identity theme in the walls or in the environment, because it might be different.
How might you incorporate some of the sensory strategies into a behavior intervention plan?
So I would say things like allowing students to be a part of that, depending on their age, but right, what are things, again, that they know that are soothing and helpful for them? Is it having a fidget? Is it having a certain, like the putting just butcher paper on a kid's table can be, right, so that they have that space to do that? Do they need to be able to sit in a specific seat, right? So I would say including the student and having them notice what are things that are calming or helpful to them, that they can use as part of their intervention plan. And again, not as punishments or rewards, but just as the basic level of things that we can use with this kid. Yeah.
Yeah, the proactive support. Do you have some ideas on how we might get other staff members, teachers, administrators, paraeducators on board with the similar noticings, conversations, proactive approaches?
Yeah, I think that's important because it's not just our classroom, right? Like, how can we make the cafeteria or whatever other the PE space, right? Be nice. So I think for that one, just having conversations with people, right? And then this is something that, again, is something that maybe we've never thought about, but when you hear it, right, you're like, oh, that is true. I really don't like this particular sound, or right. So it is something that when people hear it, they can see how they are, right, that this isn't just a kid with a disability. This isn't, oh, it's because they're autism or, whatever, right? We all have particular sensitivities. We all have particular preferences. So I think just having conversations. I always like to share articles and things that I've read that I think are helpful. Not everybody likes that, but there's some people who might respond well to that, right? I'm not making this up. This is,
right. Like these aren't interventions specifically for individuals with disabilities or have IEPs. This is part of a human need that we all have, right? In many ways. And so making that part of a human need that we're all talking about, because if we're not talking about it, then we won't attend to it. Friendly reminder, folks, too, you can use this recorded webinar for any training purposes, even if your team members aren't here to, start these conversations.
And I think it's important to note too, that as adults, we have much more autonomy, right? So if I don't like a space or it makes me uncomfortable, I can leave, or I can, whatever I can, right? Our students don't have that choice, right? They don't get to just decide they don't want to do that day, or they're going to change the way the space is, or, they don't have that. So yeah. So giving them that autonomy is really important.
And Sarah in the chat brings up that it ties into UDL principles.
Yeah. I think so. UDL is we always think about it as an instructional tool, right? But definitely the environment, creating it so that it's accessible to everybody. And again, the multiple means, right? So the people who are asking things like, how do we meet everybody's needs? It's very similar to these UDL principles, right? Having multiple ways. One way isn't going to hit all of your students, right? And it might actually hurt some of your students, right? So having the multiple ways of everything, and thinking about your space being accessible to as many people as possible.
Mhm.
And some of those things brought in are so well intentioned, but they
Mm,
backfire. They
that's a
backfire.
really good point. Yeah. Yeah.
Mhm.
We're told to have really colorful, exciting
Yeah.
classrooms. We're told to put up their student, I mean, right? So yeah, they're
Mhm.
not
Yeah.
doing,
The Lakeshore catalog,
yeah. Very
everything but
colorful.
primary. Yeah.
Yes. Yes.
Do you recommend teaching coping and or desensitization to some of the things that a student may be sensitive to? And if so, how?
Hmm. Um, so yeah, so as I said in the beginning, vagal tone is something that is not static. We can change that, right? So I think both is needed, right? We definitely want our students to be more comfortable in their environment, right, and to be able to handle those stressors. But we also need to not put the full burden on them to do that, right? Part of that burden is ours to create a space that is not overwhelming and really taxing on their nervous system, right? So for us, right, who we just go through the day and it's fine, but it's a lot for some students to be in our classrooms for 8 hours a day and have everything attacking all of their senses all of the time, right? It's exhausting. So yeah, I would say both is needed. You want to increase your students' flexibility and their ability to handle different things and know what they need when. But some of that burden is on us also to not be subjecting them to spaces that are really taxing for them.
Mhm.
Mhm. Yeah, and Sarah said in order to do so, we may need to adjust our sensory environment. Yeah. Mhm.
Mhm.
And to that point, Christy's question here, how can we strengthen our vagal tone? What practices, exercises, what can we do to make that connection for ourselves?
So I will say you can join some of our training. So this is like I said, Dr. Nikki is really an expert on this. She teaches about this all the time. So there's a lot of mind body work that goes into that. Breathing exercises, things like that. There's something called the Safe and Sound Protocol, which is a listening thing that is designed to improve vagal tone. So the idea behind the sound is when people have been in trauma a lot, or for lots of other reasons, just physically, maybe it developed this way. They're attuned to listening to the super high or super low frequencies. So things like sirens, like things that tell you to be alert and that there's danger, right? So sirens, things like that. And then on the low frequency end, like earthquake rumblings, right? So the idea is that the middle ear, which registers the middle frequencies, is not as trained, right? Because they're always listening for those super high or super low. They're always being on alert. They're always paying attention to that. So the Safe and Sound Protocol is specially filtered music. So the middle frequencies. So if you think about, when we talk to our students in a low voice, a mother singing to her baby, right? These are all those middle tones that signal safety, right? So it's designed for your ear like a muscle to be more trained in listening to those. So that it's with the provider though, the Safe and Sound Protocol. But yeah, so there's lots of things that you can do, and I
I
love
think
that
about
question.
that a lot up and down California with fires.
Yeah.
And our kids were really exposed to a lot of scary siren sounds during that time. And just in general, scary things happen with sirens. But I think about that a lot for that reason.
Yeah. If you could recommend one small change an educator could make after this training, what would that one small change be?
I love that. I think just starting at looking at your space, right? Just looking at it from your student's eyes, right? Or looking at the hyper and hyper, right? So again, you've designed it in a way that is nice for you. So just noticing is the first step, I think, right? That some of the nice, good things. So I love that quote from that teacher that said, just because it's a nice place to be, right? It's all nice and cozy and you made it a really nice place to be, right? And you included personal things about the students, all of those things. But that doesn't always mean that it's a place that feels good for your students. So I think the very first small change is just looking at it through that lens, and then easy things that you can change, right? So, our classrooms are some things that we can't change or that would cost we'll have to bring in things, right? So, but what are the really small things that you can adjust really quickly, like removing some of the clutter, putting a piece of butcher paper on a student's desk, right? So just noticing what those small things are, and then.
Yeah. Yeah, I appreciate that, because I think that's what we see and hear a lot, is that folks feel really restricted by the resources they may or may not have, especially in some of the upper grades with big bodies in small classrooms.
Yes.
A lot of humans, big bodies, lots of sounds in small classrooms. So just acknowledging what is a small change you can make personally, whether it be that adjustment of the temperature or the colors or talking to your students about it. They're all
Yeah.
things that are within your control.
Yeah. Like maybe you're just playing some nature sounds for the first, few minutes of class when you're taking attendance or whatever, right? Just,
Right,
yeah, it doesn't cost money to do that.
right, right.
This next question I love, because it's also going to help us work with families.
Mhm.
Can you recommend any processes for preparing students for other environments that aren't as thoughtful as our own to their needs?
Can you say it again?
Can you recommend any processes for preparing students for other environments that aren't as thoughtful as our own to their needs? So we put all this work into our classrooms, and parents, I want us to include parents in this, because parents put a lot of work into their homes and environments, and we take such great care, but how do we prep them to go into other
Yeah.
places and spaces that aren't so thoughtful?
So again, I think normalizing that autonomy in students, right? So being able to speak up, right? And I've noticed, I sound very old when I say this, but the younger generation, they're very able to just say, this doesn't work for me, right? Words, that was not a thing when I was growing up. But yes, I think really normalizing that, right? That they're doing it in a respectful way, right? But I think first knowing some students might not know what is, right? They just know this space feels good. They don't know what about that space is making them feel good. And they know that this other space is very stressful to them. So first helping them have that language and understanding those things, and then helping them to be advocates for their own needs. And again, it's not something that's just good just for them. It's something that, could benefit other students in the classroom as well, right? Yeah, I think that's a really good question. We can't keep them in our little bubble always, right? So helping them to have that language and being able to advocate for themselves.
Yeah. Yeah. Once we're talking about it and we're acknowledging it, we can support our students in finding the language to advocate. Well, thank you so much, Sylvia. Do we have we still have more questions. They just keep coming in. Do you have strategies to teach and model the use of a calming corner so that it is being used appropriately? This is actually a good question, because I hear this a lot. But then we want to make sure that kids aren't overusing it or staying in there too long. How do we monitor that? How do we teach our students to really recognize it's because there's a need?
Yeah. So I think the first thing is the way that we view our students, right? So there's a difference in how we approach students if we just assume they're going to abuse the space, right? Versus whenever we take the understanding that they're going to use it appropriately, right? So I think that's the first thing is approaching that, right? And not because I think what happens whenever we take the first view is that we sort of use it as like a reward or a punishment, right? So it can be if you're good, then you can go up there, which sort of defeats the purpose, right? If I wouldn't need to go to the calming corner, right? Or as a punishment, you're acting out, you need to go sit over in the calming corner. So I think shifting that little bit in our perspective, right? And then, yeah, some teachers have like timers over there, so they know, and you have an agreed amount of time depending on the age group that you're working with, right? What would be appropriate, and just setting up some community guidelines and norms the way you would for any other space. Whenever you do centers, this is how we do centers, right? We don't throw it, right? So the same that you would do anything else, right? Before you're introducing, this is this area, this is what it's for, this is how we're gonna interact with this space.
Mhm. Can you give us the idea of what that could look like in the upper grades? If we didn't have something like a cozy cube, obviously. I liked one of the chats earlier. They're like, my high school students would have a hard time sharing this space.
Yeah, so I think with the older kids, it's really important also to include them, right? They're much more able to articulate what they need, right? And I would say co-creating the guidelines with them, right? They are co-creating the space for their needs, right? Because again, it might be different from what I would choose to be in that area, and then co-creating the guidelines around that.
How do you use that? Yeah, great.
This next question, I think, is going to be very useful to a lot because we usually have one suggestion for noise. So, what might you recommend for a second grade student who is highly sensitive to noise, especially during independent work or group activities when classmates are talking or collaborating beyond headphones? Because that's
Beyond.
typically the one thing, and some kids hate them on their ears.
So I would say, so like the example of the teacher who allowed the student to move away, right? So having choice in where they want to sit, it might be less distracting and less stimulating for them to just be a little bit away from some students from the larger group, right? If you have the ability, I know we had a teacher who, again, their particular space allowed for this. They could set the desk a little bit outside. They could prop the door open and then the kid could just, right? So the teacher could still see the kid, right? But they were just a little bit outside the door. You could do that in a hallway, or if you had a door that goes to the outside. Yeah.
I love those. Giving them a little bit of control in that
Yeah.
situation, I think would be really helpful.
Yeah. Yeah. There's like little, I don't know, some students like the small thing. I don't like that, but they have the little things that they can just kind of put around them at their own desk that kind of.
Yeah, the cheater boards.
Flexible. Yeah.
The stapling, I mean, when when low tech was the only option, stapling together some folders and making a little barricade is also helps kids focus.
And it might be a thing where it doesn't need to be all day long, right? If we can get them to that middle, to that heart, right? So it might be they just need a super quiet area for like 5 minutes or whatever before you start, and then they can come in and then they're able, right? But if it's just like a continuous onslaught, right, that's when it becomes too much, right? Yeah.
Yeah.
Maybe they just need a really quiet area for just a little bit, and then they can come and join the group, right?
How can teachers normalize differences in sensory sensitivities or model their own awareness in the classroom?
Yeah, I think the modeling is important, right? So just naming it, right? That definitely helps to normalize it and helps. I experience it different from you, right? This isn't good or bad. This is just how I am, right? What do you like, right? I definitely think that's important. And then, whenever you have a kid who is over there and why does he get to go over there and nobody else gets to, right? Having that conversation. Yeah.
So you mentioned hygiene. Can you clarify again how sensory sensitivity applies to hygiene?
Yeah, so the kids who are hyposensitive, right? They're not aware that they feel sticky, that they feel gritty, right? So that's how that plays into it. Or they might, on the other hand, they might like feeling that, right? They want to have something to be touching. So did I understand the question?
I think so, yeah. I don't know who asked that, but if there's any clarifying questions needed, feel free to drop it in the Q&A or the chat.
Or they're over.
I'm scanning for the team, yeah, to see if we have any outliers. Sarah, do you have any others that you've pulled? Okay.
Nope, I think we.
Yeah. Thank you so much, Dr. Mack, and thank you to everyone for joining us today. As a friendly reminder, we will post today's session as soon as we can. It will be on the password protected Padlet, and then from there we do put everything on our website. And hopefully in about a week the webinar will be posted. We hope that this session has provided you with both reflection points and practical strategies to support your students and honor their dignity, agency, and belonging. We look forward to seeing you in, sadly, our final session, which is on December 3rd, and that will be led by Mitch Weathers from Organized Binder, and he's going to be talking to us about executive functions for every classroom. So creating safe and predictable learning environments and really focusing on executive functioning. Until then, take care of yourselves, keep leading with community, connection, and heart. And for those who are experiencing the newly wild California rain, be safe out there. Have a great evening, everyone. Bye. Thanks, everyone.